Stem cells have an amazing ability to treat, cure, and restore. They are already being used to treat red blood cell diseases such as Fanconi anemia, white blood cell diseases such as SCID, some types of cancers, and tissue development. And who knows how many other diseases could be treated with stem cells after more research. The definition of stem cells is that they can divide and differentiate into specialized cells. There are two types of stem cells: adult stem cells and embryonic stem cells. Adult stem cells can be found in many human tissues, including cord blood and bone marrow. Embryonic stem cells are found in a fertilized embryo at the blastocyst stage, which is 4 to 5 days after fertilization. Embryonic stem cells are more versatile in the types of cells they can become, as they can become a wide variety of different types of cells, whereas adult stem cells are more restricted in the types of cells they can become. However, in order to retrieve embryonic stem cells, the blastocyst must be disposed of. This raises ethical issues related to the debate of pro-choice or pro-life. In my mind, our government has decided that abortion is lawful. And if all the people in the world who aborted babies gave them to be used for the purpose of embryonic stem cells, at least they'd have a better reason to die, and other people's children could have the chance of life their child never had. Of course, I wish babies didn't have to die before they'd had a chance to live, but I still see this as the better option. As I mentioned before, adult and embryonic stem cells can be used to treat some different genetic diseases and some types of cancer, including leukemia. Acute myeloid leukemia, also known as acute myelogenous leukemia, or AML, is a quickly progressive type of leukemia in which there is rapid growth of normal white blood cells that build up in the bone marrow and interfere with the production of normal blood cells. Following chemotherapy or radiation, some patients undergo bone marrow transplant, where they replace the patient's defective or destroyed cells with the donor stem cells found in the bone marrow or in an umbilical cord. If stem cells from the donor's body are being used, they are usually taken from the donor's hip and are received by the patient in a process similar to blood transfusion. The patient will be monitored closely afterwards to prevent and treat infections, side effects of the treatment, and complications. One possible complication that could occur after a bone marrow transplant is graft versus host disease, or GVHD. This is where your donor cells attack your body because they see it as a foreign substance. The severity of GVHD can range from mild to life-threatening. Siblings tend to be the best choice for transplant donors, and the more closely matched your donor is, the less risk you have of getting GVHD. However, the only way to completely eliminate the risk of getting this disease is if your donor is your identical twin. Because siblings are the best option for donors, some parents will use what is referred to as savior siblings to help their sick and dying child. This is a baby who is created for the treatment of an existing child who is affected by a serious or life-threatening condition. A savior sibling is conceived through in vitro fertilization and then tested to check if they will be a match for the sibling and to make sure they don't have the same genetic disorder. Then, once the baby is born, the stem cells within the umbilical cord are harvested to give to the patient. Many see this as controversial for two reasons. One reason is that the fertilized embryos, which are not deemed fit, are discarded, once again taking away the chance of life from a baby who is not yet even really considered to be a human being. I wonder if more people would see this as an issue, if they really thought about this in the way we think about death for us or for a family member or friend. Whenever most people hear of a youth dying, a common reaction is, oh, they didn't get to experience enough of life, or they could have done so much with their life, and it's not fair. But think about it. These embryos didn't get to experience any of what we classify as life, and who knows what they could have done with their life had they been given the chance. Another issue is that there is the fear that once the child has served its purpose, it may be given up for adoption, misused, or treated merely as a commodity. I guess it all depends on the parents. if they really wanted another child, and if the savior sibling will be loved and cared for in the way it should be. If they will be, then it's just one more different reason to have a child, and I don't think this reason should be considered any more or less ethical than, say, having a child to have someone to care for you in your old age. Stem cells are a complex issue that can be the source of many debates. I guess it all comes down to perspective, but if used in the right way by the right people, stem cells have the ability to cure many diseases which currently have no known cure, as well as possibly being the cure to many diseases which currently have no known cure, as well as possibly being the key to preventing and treating things like birth defects. So, while there are still some issues that need to be worked through, hopefully stem cells can soon be widely used to treat, cure, and restore, providing hope for people with chronic diseases.